There's a rare genetic disorder that affects approximately 30,000 to 50,000 people in the US. This condition involves the growth of tumors along nerves, which can cause pain, mobility issues, and changes in appearance. Now, today, from Washington University School of Medicine, right here in St. Louis, I have Dr. Angela Herbie in Austin, who's a patient advocate. Good morning to both of you. How are you?
Good morning. Doing great. How are you?
Morning.
Great. Doctor, can you tell us about the rare disease of NF1-PN and its symptoms?
Yeah. So first of all, thanks so much for having us. We're really excited to be partnering with SpringWorks Therapeutics to try to bring more awareness about neurofibromatosis type 1 plexiform neurofibromas. So NF1 is an inherited genetic condition. It's actually the most common tumor predisposition syndrome. So it affects about 1 in 2,500 people. And the most common tumor that patients with NF1 develop are these plexiform neurofibromas. And these are tumors that can happen anywhere in the body. They tend to involve multiple nerve roots, and they can cause a lot of pain for patients. They can also be very disfiguring. And, depending on the location, sometimes these internal tumors can actually push on organs and cause organ damage.
Now, Austin, you have lived with this condition since childhood. How has it affected your life and how are you doing today?
Yeah, so I was diagnosed at a very young age, and at a young age, I had to have two surgeries in the same year because both times it was growing into my spine. They could not remove all of the tumor because it would have caused paralysis. The first surgery they removed, the portion they removed was the size of a foam football. Later in the year, they had to go back in. As I said, it was growing into the spine again, and it was the size of a golf ball. That was during the time, when I was at the age where you're supposed to be learning how to swim, ride a bike, all those fun, life stages. And I was pretty much bedridden, and I actually kind of had to learn how to walk again and do, real basic life skills again. So later on in life, I was learning how to do all those fun things. And, my life steps were a little bit slower, and there was times where my mobility wasn't as good as all those kids around me, and I had to take things slower, and sometimes where I had to sit on the sidelines. As I grew up older and older, issues had occurred where I still had to sit on the sidelines. But I continued and progressed. I wanted to pursue a career in the military, but unfortunately with my tumors, I could not. I did go into a law enforcement career for a short period of time. Unfortunately, my tumors got the best of me to where I could no longer even do that career, so I had to resign from that. Today, I'm doing a lot better. About 5 years ago, though, I was doing pretty bad until I found a clinical trial with Dr. Herbie, and I ended up getting on it. And within the first year, I was kind of debating on getting off the clinical trial just because everything in my life that was going on and the constant going to doctor's office was kind of bothering me personally. But we found out at that 1 year checkup that my tumor had shrank 57%. And, my pain was starting to decrease some. But finding out that tumor shrank 57% and the pain decrease made me decide I had to stay on that clinical trial. And I'm really glad I did because my pain's decreased even more. And I've been able to do a lot more things I love to this day. I'm an Eagle Scout. I love to do a lot of things outdoors, camp, hike, fishing, especially kayaking. And I've been able to do those things for an extended period of time, a lot more than I used to, thanks to having more or less pain in my life. I'm now a pastor, and I'm loving helping other people in my life and helping advocate for others around me.
You've been through a lot, Austin. It's a journey there, man. That's an interesting journey. Definitely.
Yes, sir, it is. And that's the short, sweet part of it.
we we're waiting on documentary number two, and then we can get the rest of it in, right? Definitely.
Yeah.
Doctor, how can patients with NF1-PN manage their disease?
Yeah. So, every patient is different, so it's really important to talk to your physician to figure out what is the best treatment option. I think historically we were really limited to surgery as being the only treatment option. And like Austin's story kind of tells, that's far from perfect because most of the time we can't get the entire tumor out. And even when we can remove part of it, more than half of the time the tumors grow back. In February of this year, very excitingly, we finally had the first FDA-approved medication for both adults and children with NF1 plexiform neurofibromas, and that's a medication called gomekli or mirdametinib. And the medicine has been shown to shrink these tumors significantly and also to reduce the pain that patients are having. Every medication comes with side effects. The most common side effects that patients experience with this medicine are GI side effects, so things like nausea, vomiting, most often diarrhea, and then rashes like an acne-like skin rash.
Now, doctor, where can we go to learn more?
Yeah, so you can go to gomekli.com. That's GOMEKLI.com. I think another great resource for patients is the Children's Tumor Foundation website. You can find information on diagnosis, treatments, and just support resources for patients.
Doctor, another question for you I have to ask is Washington University right here in St. Louis does a lot of research in finding things. Uh, how do you feel about this funding being cut? How's that affecting Washington?
Funding cuts are always concerning, and I think that's another important thing that we as a society need to advocate for. Research is important to help patients. It helps all of us, and so, I hope that we can join together and make sure that we keep scientific funding in place.
Austin, you're a pastor now and you serve your community, but you seem to have a lot of energy there. So are you a pretty good advocate in talking to other people with the same type of condition you are? I mean, you look like somebody that's ready to take on the horns.
Yeah, no, I love talking to other people that are experiencing similar things such as I or other people with NF1-PNs. As Dr. Herbie mentioned, everyone with NF1-PN is a unique, different case. We maybe all have it, but we're kind of in a parallel battle. It's not all our cases are different. But I've been through a lot with mine. I've been through a lot of vigorous different things, and I could help be there for other people and be there and advocate and say, hey, you're not alone out there. I've been through a lot. I may not be going through the same experience you are, but I have been there through the trenches, and there's hope out there. There's people out there that are there for you, and people out there that have gone through similar experiences.
Austin, I like that because as a pastor, not only do you can talk about that, you can also use that in community with your congregation and other people that you talk to.
Yes, I can, definitely.
Definitely. All right. Austin, I'm going to say this. You should be playing for the Battlehawks, man. That's what I'm going to say here in St. Man, you got some strength.
I don't know if I can do that.
You got some inner strength there, brother. You got some inner strength. I like that.
I don't got the outer strength or the back for it.
But you got that inner strength, man. I like that. I like that a lot.
Yeah.
Austin, Doctor, thank you so much for joining us on Morning Blend. It's been a pleasure talking to both of you, and particularly to you, Austin. I like your spirit. I like your spirit.
Thank you very much.
Thank you.